Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Oncodermatologists play a critical role in the cancer care team. Our guest today explains how to build an oncodermatology team within the cancer clinic, who needs to be on that multidisciplinary team, and how it can increase quality of care. Joining us today is Dr. Meghan Heberton, the Director of Oncodermatology at UT Southwestern Medical Center, Harold C. Simmons Comprehensive Cancer Center in Dallas. Thanks for joining us, Dr. Heberton. What steps should cancer centers follow when starting an oncodermatology program?
Well, I think that's a great question. There's a lot of things that go into building a successful oncodermatology program. First and foremost, I think you want to find somebody who's really interested in the field and motivated to practice oncodermatology. We have so many young trainees and academic residency programs who are working with oncodermatologists that have been practicing for a while. They're coming out of residency and they're excited to start practicing. So somebody with that motivation, and then also, if they have some experience in the area, that would be ideal because these are niche areas where we're really treating subspecialty conditions. So you want some experience in that area before you start practicing alone. The other thing I would say, which I've worked with a lot at the Simmons Cancer Center, is setting up the dermatology practice within a group that is used to working primarily with oncologists. Dermatology clinics have to be designed differently for success. Just like any other specialty has its own way of doing things, we depend on usually a higher number of rooms that are sort of constantly in motion. And we also integrate procedures directly into our clinic visits, which is a very different model than a lot of the types of clinics that are usually run within cancer centers. So leadership has to have a willingness to set that up to allow both parties, both sides to be successful.
When other providers are on the patient's care team, what strategies do you have to make sure that things are getting communicated?
Well, I love communication. It's one of the reasons I did academics is because I love talking to other specialists and trying to learn consistently about what's going on with my patients and practice. I think I'm especially cognizant of some of the potential gaps that could occur because before I did dermatology, I was an internal medicine resident. And even though I felt very capable in internal medicine, I strongly recognize, having done both, that you don't always get a lot of dermatology training when you're going through medical school and subspecialty residency training, unless you do a dermatology residency. And I always tell my trainees in any lectures I give, like, I don't expect the person sending a patient to me to be a dermatologist. That's my job. And so after I see a patient, especially if something's particularly complicated, I think they're going to need to be dose reduced. I think it's not really clear if something's related to the therapy they're on or not, or especially if it's absolutely nothing to do with the therapy that they're on. I'll send a message. If I'm down the hall, I'll walk down and say, hey, I saw this today. Thanks for sending this patient to me. This is what I think is going on. And I find that, with our medical record, there's lots of ways to send messages. And I try to triage that based on urgency. But I think that direct communication breeds familiarity and also collegiality. It allows for us working together. Maybe you see a pattern that you never saw before because you're actually directly talking to the person who's taking care of that patient in a different way. And even though we all write good notes, sometimes you don't always understand their thought process unless you talk to that person directly. So I find that incredibly helpful. I've made a lot of great colleagues through direct communication. And I try very much, unless it's something very mundane, to just update teams regularly. And I'll always make sure with the patient that I understand who that team is. Although having done this for a while, I can figure it out pretty quickly.
Finally, how can working with an oncodermatology specialist from the beginning provide a higher level of care and expedited patient diagnosis accuracy?
I think that's a great question, something I'm really passionate about. If you are working with somebody who has familiarity with the therapies that you're on from the beginning, you're going to have a better diagnosis from an earlier onset, which will lead to more accurate treatment. I see a spectrum of outcomes where I see patients who have had over attribution to the therapy that they're on because of unfamiliarity with either the dermatology condition or the cancer therapy. And that can lead to preemptive interruption of therapies that are really necessary for cancer care. And then I also see like sort of uncertainty as to how to best proceed from patients and providers that just aren't used to either side. So if you have somebody with confidence moving forward on familiarity with this context, I think that you just end up with having more expedited and accurate care.
Thank you, Dr. Heberton. You can find more on today's topic by clicking the link in the show notes. Don't miss our next episode. You can follow our show right here on your favorite podcast player. Look at the top right corner and tap the follow button. Thank you to Johnson & Johnson for their support of this program. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.